Awesome. And so what's a SNAP form?
So a SNAP form is a quick diagnostic tool that often GPs will use, just looking at a variety of different behaviours. Usually GPs are looking to see if the behaviour is presenting in different environments, but Matt might be able to talk a little bit more about a SNAP form.
Yeah, no, that sounds good. Yes, SNAPs, it's the ones we usually use have 26 items, and there are 9 inattentive items and 9 hyperactive impulsive items. So they're the symptoms of ADHD, and then there are 8 questions on oppositional defiance sort of symptoms, more behaviour issues. And yeah, as Emma said, just gives you an idea about how is that particular person presenting in the school environment, how are they presenting at home. And you have to take them with a wee bit of a grain of salt, because if a teacher's depressed, then they'll rate the kid quite high, or vice versa, if parents struggling, often they'll rate higher. But it just gives you a really good idea about how they're doing across context. So with ADHD, usually you need symptoms both at home and at school, or in 2 environments, and that gives us an idea of that. So really helpful.
Is that like the CADRA forms?
Yeah, the CADRA forms of they use an absolutely similar thing, basically a SNAP. Yeah.
Okay, cool.
Yeah.
And so, if a child is presenting differently at school than at home, is that something that's going to be difficult to navigate?
Yeah, that's interesting. So, sometimes a parent might find a lot of ADHD symptoms at home, and school says they're fine in our environment, and that could be that the teacher's just not seeing behaviours that are there, but it could be a guide too that there are other issues at home that might be important to be thinking about, and vice versa. Often if kids say they have a learning problem like dyslexia or specific learning difficulty, you'll expect some inattention and off-task behaviour with that, because school isn't keeping their interest. So that's sometimes pointed towards more education things being important. So yeah, it can help SENCOs and GPs just kind of navigate, is it more likely to be mainly a learning issue, or mainly ADHD, or more behaviour issue, which might need different treatment. Yeah.
Awesome. Thank you.